So more than 50% of brain tumors are actually metastatic. So they are coming from a source outside of the brain. For example, breast cancer or lung cancer. And less than 50% originate in the brain. So these are things like meningiomas and glioblastoma multiforme, GBM, and other types. However, the bottom line is similar. When you have an extra mass inside the brain, the pressure overall will increase. So you're going to get very similar symptoms to what I discussed with the IIH, such as the headache, the nausea, the vomiting, the vision changes. However, in addition to all of that, you have specific things that only happen if you actually have a structural brain tumor inside the brain. And those will include seizures. So if you have a tumor, for example, right here, it will irritate the cortex around it. That can lead to seizures. Additional things that can happen will be focal deficits. So depending on what part of the brain it's in, it will usually suppress the neurons inside that region. Let's say it's in the part of the brain that controls your right arm, then by having a tumor in that spot, you're going to have weakness of the right arm. Now, to diagnose it, we need an MRI. A lot of times with contrast dye and other imaging modalities can be needed too, to check the metabolic activity inside the tumor. Treatment for brain tumors will often include steroids to decrease the swelling happening around the tumor. And it will usually include a mix of chemotherapy, radiation, or surgery, depending on the cause of the brain tumor.